Can a facelift be performed with local anesthesia?
Facelift surgery is considered one of the more complex and extensive cosmetic surgery procedures. This surgery involves working below the face and neck skin and manipulating delicate tissue in order to lift and improve the appearance of the cheeks, jowls, and neck. As a reflection of common practice by general plastic surgeons, it's typically assumed that facelift surgery can be performed using general anesthesia only. The thought of being paralyzed temporarily and being placed on a mechanical respirator can be the primary reason a lot of people avoid surgery and keep spending time and money on ineffective skin heating procedures. I'll discuss how I perform all forms of facelift surgery in my practice under local anesthesia with light IV sedation, thus avoiding general anesthesia altogether. For my patients, this approach allows them to enjoy their natural results with quicker and more comfortable recovery. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. As early as during my training in facial cosmetic surgery, I was formulating concepts and methods to perform facelifts with local anesthesia instead of general anesthesia. I performed the full range of facelift techniques, from mini facelifts to deep plane face and neck lifts, using local anesthesia with light IV or intravenous sedation. So why is general anesthesia something to be avoided whenever possible? Well, during general anesthesia, you are completely unconscious and paralyzed, requiring a mechanical respirator to keep you alive. General anesthesia requires both intravenous drugs and drugs delivered through gases, which you breathe in. Due to the type of drugs used and the effect of general anesthesia on your brain and body, patients can experience nausea, vomiting, and even memory loss. It's common practice for patients after general anesthesia to stay overnight at a hospital or surgery center with close monitoring by nurses. These patients often have extensive facial bandages as well as drains, which also need constant attention. Patients who have surgery done with general anesthesia, in my experience, take a longer time to recover from surgery, as they are also recovering from the effects of the anesthesia. Many times these patients require pain medications in the opioid family of drugs. In light of the recent rise in problems related to opioid drug use, not to mention the associated side effects of nausea and constipation, I believe in doing everything I can to minimize discomfort, so opioid-level medications are not necessary. In contrast to general anesthesia, there are many advantages to performing facelifts with local anesthesia and light sedation. With local anesthesia and IV sedation, my patients breathe on their own without any need for mechanical assistance throughout their surgery. I also prefer the ease of movement I have to work on the face and finely tune what I'm doing without a breathing tube or other devices distorting the patient's face. It's important that results look as good as possible in the operating room so you look good after surgery. By using local anesthesia with light IV sedation, my facelift patients are more comfortable both during and after surgery. IV sedation using drugs like propofol combined with local anesthesia allows me to avoid the use of opioids like fentanyl. My patients sleep comfortably and are easily awakened after completion of their procedure. I place a light facial bandage with no drains after surgery. Facelift patients are typically in recovery for 1 to 2 hours after surgery before walking out on their own and being escorted home. I feel that this is preferable to recovering from general anesthesia and needing to stay overnight at a hospital or other facility. I have found a faster rate of recovery is a major advantage of using local anesthesia with IV sedation over general anesthesia. Our patients routinely return to work in a week to 2 weeks with limited swelling and minimal bruising. While the use of local anesthesia with light IV sedation has made facelift recovery faster and more comfortable for my patients, there are other facelift procedure methods I've also developed to optimize the camouflaging of incisions. I use advanced wound healing technology such as extracellular matrix and PRP, or platelet-rich plasma, which has a remarkable effect on the healing of the skin, helping make the incisions look less conspicuous. Many of our patients will also have other rejuvenating procedures at the same time as a facelift, such as upper and lower eyelid surgery, chin implant, and injectable fillers. All of our surgeries are performed in our own certified operating facilities within our office. Our patients are comfortable and also assured of the safety and quality standards which are in line with hospitals and surgery centers. Throughout my career, I've been an advocate of having cosmetic surgery such as eyelid surgery and facelift surgery performed with local anesthesia and light sedation. The medical literature is beginning to acknowledge this, thus validating my conviction of standing up for patient safety and comfort. Of course, in addition to safe and optimal anesthesia practices, it's important that you and your prospective surgeon have a clear understanding of the aesthetic outcome you can expect after your facelift surgery. I hope you found this information helpful. Thank you for your question.